Hi, everyone. Welcome to Destination Healthy Skin. We're so glad you can all make it today. Bienvenidos a las damas y caballeros y gracias por estar con nosotros en el programa de Bien Salud de su piel. Aunque nuestro programa hoy día no va a estar completamente en español, puede visitar a nuestra página de Facebook y obtener la información cuando quieras. Hi, everyone. I'm going to go back and forth from Spanish and English. My name is Denise Bello-Bellini. I'm the Breast Health Navigator for Northern Westchester Hospital, and I'm also a mom. Welcome officially to our Destination Healthy Skin, the program that's brought to you by Northern Westchester Hospital in partnership today with our Cancer Wellness Center and the Center for Healthy Living. We have a very special guest with us today, helping us have fun in the sun, and this is Dr. Stallings, and I'm just going to give you a little bit of information on her. Dr. Stallings is our board certified dermatologist, specializes in adult and pediatric medical and surgical dermatology, as well as cosmetic dermatology, very important. She has extensive expertise and skill in treating numerous dermatologic conditions, along with a wide array of cosmetic procedures. Along with being an empowered female, she has published articles on medical and cosmetology, dermatology, and peer-reviewed journal articles, and co-authored a chapter in a textbook on aesthetic rejuvenation. We are very honored and happy to have her here today with us. Welcome. Thank you for being part of the event with us. And before we go any forward, we just want to advise everyone that we are following the protocols at hand. As you'll notice, neither myself nor Dr. Stallings have our masks on. We are fully vaccinated and we are following the CDC protocols along with throughout the program. We will be making sure to clean up so that we're not spreading any germs. We are in a medical office underneath all the guidelines. Let's get started. Okay, before we go further, we want to preface that we know that this has been a very difficult year for our community, for our nation, for our world. And we in no way want to undervalue and estimate what COVID has done for us all. But here at Northern Westchester Hospital and Northwell Health, very much value and hold important the mental health of our patients and our community. So we want to take advantage of the summer coming along, but since we care about our community, our neighbors, and our patients, we also want to make sure that everyone knows how to have fun in the sun in a safe way. So Dr. Stallings is going to help us do that today, and hopefully we'll all get ready for Memorial Day week coming up. I'm so excited. Vacation, no rain, hopefully. Not allowed. So before we go into the SPF and the fun stuff of the program, I guess, I think we should just preface with what is skin cancer? What should we know about it?
Sure. So skin cancer is actually the most common cancer in the United States. There are the two most common, which are basal and squamous cell carcinomas, highly curable, especially when caught early. Then the third most common is melanoma, which can be more dangerous, higher incidence of death. But again, when caught early, all of them are highly curable.
That's amazing. So the majority of the 3 cases of skin cancer are from ultralight that we get from the sun. Can you explain that a little bit to us?
So UV light, the most common natural type of UV light that people encounter is from the sun. The main rays that we're going to focus on are the UVA and UVB rays.
Okay.
UVB rays, you want me to get into a little bit of the specifics?
Let's
So UVB rays are the ones that can lead to sunburn, and then ultimately with prolonged exposure can lead to skin cancer. The UVA rays are more, they cause skin damage that leads to tanning, and then ultimately to skin aging and wrinkles over time. And there are
not want that.
No, the shorter wavelengths also do contribute to skin cancer.
Okay, that's important. And later on in the program, we are going to get into specifics of SPF, what the differences are in totals from 35 to 100. But we just want to talk about the risk factors now and kind of just let the community know what they should be looking out for. So in terms of, I don't know, medication, are there different a list of things that we should worry about?
People are at varying risks depending on a variety of factors. Their skin type, where they live close to the equator, the amount of UV exposure they've had, family history of skin cancer or melanoma, And in general, there are a few different guidelines that we can go through if you want to expand.
Well, one thing that I was not very well versed in, and I don't know if there's anyone watching, any of our viewers have the same question, medication.
Sure.
Is there an issue with drinking antibiotics or being on specific medications? Am I going to get a tanner? Am I going to get burnt? Should I not? How does that work?
Sure. So there are certain medications that can be photosensitizing or increase your sensitivity to the sun. Some of them might just cause a sunburn, or sometimes you get just a rash, a skin rash.
Okay.
There are a variety of different ones. Hopefully, if you're given some of them that are photosensitizing, your doctor will review that with you. But some of the more common ones are antibiotics like doxycycline, which we often give for acne, for Lyme disease. That can be sun sensitizing, and ciprofloxacin is just another. Sometimes just some of the anti-inflammatories that you might take, like ibuprofen or naproxen.
That's good.
Yeah, and then there are some of the other like antipsychotics and certain other medications, problematic, certain diuretics. But again, azithromycin, not so common to cause sun sensitivity, actually.
I'm not sick, but I'm just asking.
Not a common one.
So since we're on the topic of medication and the sun, as I said before, I'm a mom as well, and I'm part of the mommy groups. And a lot of the moms, especially in the non-English speaking, which is I speak Spanish, and I also speak Italian, a little bit of Portuguese. So I get a feel of what everyone's saying. There are some questions with regards to the COVID-19 vaccine and being in the sun. Is that something that we should be worried about if we've gotten it, or our children if they're getting the vaccine?
I would not worry. We don't know anything about any sort of sun sensitivity with the COVID vaccination.
Good.
So I would go forward, get your vaccination. Do not worry about it. Of course, still practice all of your sun safety measures, which we will get into more, but I am not concerned about it whatsoever.
That is a good answer. I know that a lot of our viewers had submitted that question as well when they were registering for this event. So I hope that you were able to hear the answer. And if you weren't, COVID-19 vaccine has no complications in the sun as of now. So get your vaccine so that you can enjoy having fun in the sun. The other thing I wanted to talk about was symptoms. So I noticed when I came into your office today that you have these very nice informative cards here, which just kind of give a picture of what melanoma will look like on the skin, different places that you should look for on your body.
Sure.
What should we be noticing? Should we be our own doctors, or should we
follow up? Okay. So mainly any change in your skin. If you have a new growth, a new mole, a mole that has changed shape, size, color, a sore that doesn't healing, anything that you've noticed that is different, out of the ordinary, get it checked out. Doesn't hurt to come in and we tell you it's benign, don't worry about it.
That's awesome.
Yeah.
Another thing I was wondering, and I was talking with some moms actually this morning when I was doing a card drop off, is what happened to annual appointments? Because I remember a couple of years ago, it used to be on the TV a lot. And even the primary care doctor would say, make sure you go see your dermatologist and you get an annual check. But now I'm seeing that some of the organizations are no longer saying annual check. It's just go see your doctor if you have any questions. Yeah. What do you think we should do?
So people, it's good to get an annual skin cancer screening no matter what, honestly. But it's more important if you've had a close family history of melanoma or skin cancer. If you see any changes, I do tell people don't wait for your yearly check. If you see a growth or you have any concerns, you come in right when you see that. So as it is a good idea, just as common practice, to go in yearly and get a check. But if you see anything out of the ordinary, give us a call.
So I want to make sure that if my husband is listening and you heard what she said, that she's saying you're not a doctor. And if you see anything, you should come in and get checked yourself, right? Basically, is the
exactly.
Perfect. Okay. So also talking about kind of reducing our risk. We have a couple polls that are coming in online while you're watching our event. So join in, see if you can get the question right, or Dr. Stallings is able to answer it for us, and see if you're ready for the weekend. So here we go. Reducing our risk. Is there a way to reduce our risk? What should we be doing? What are the things that we need to look for? If you're watching the event live now, you'll see that one of the questions coming up is a true or false question. It's saying you cannot get a sunburn or skin damage on a windy or cloudy day. So let's see. What is the answer to that? I'm going to say if there's no sun, you can't get burnt. That's my answer. Okay.
So you can get a sunburn just as easily on a cloudy day.
Okay.
So the UVA rays, the UVB rays, they're penetrating through the clouds. So if you're skiing, if you are, anything, sun, sand, snow, you can get burned. So you always should be.
You know what that makes sense, because I notice sometimes when we have these lovely snowstorms here, we're shoveling on a very sunny day, you can kind of get like red in the cheeks from a little burn. So that does make sense. So let's see, 83% of you got it right. That's really good because I got it wrong. Okay, everyone's listening. And what about so this is what I do. I'm going to go into mom mode. Let me show you guys. So I have a 5-year-old son, and this is what I use. I love to use Rash Guards that are made with the SPF already 50. However, trying to get my son or other children to wear this is not so fun.
Especially when you have a girl that gets a little bit older and wants to wear her bikini. Yes, agreed.
But this is a good added.
These are phenomenal. A lot of the bathing suits that are the Rash Guards are phenomenal, and they all typically have the protection.
Yeah.
Hats, sunglasses, the works.
That's another thing.
And if you don't have to buy these, I know sometimes these are expensive. So you can, if you have long sleeves, sometimes long pants, wide brimmed hats, sunglasses, you can protect yourself that way, or just lube up with the sunblock. But these are a really great option.
I noticed
especially
that
for kids.
One was from the Skin Cancer Foundation, that they support this one. Yep. I'm not going to say where I purchased it, but I purchased it at a local, just 100+ location pharmacy, with the little hat to cover my son's neck, a couple of sunglasses. And I wonder when I was looking for this, if there's a way, if we have the FSA, if maybe they would cover something like this, because I would consider this maybe medical attire, just kind of like metal durable equipment. So that's something that we can look into.
On windows covered, so hey, why not?
Yeah. So
car windows,
that's something that I'll throw to my mom group and see if somebody knows the answer, or if you know the answer to that, feel free to type into the chat and let us know. Have you been able to purchase Rash Guards or anything for your family, and it's been covered under the FSA, and you've gotten something purchased back? That would be great to know, because it's very inexpensive. All right, let's see. A question that we're getting in: clothes are sometimes more economical than sunscreen. So do you think it should be an either or, both, or if you can only do one, what should you be doing?
Kind of depends a little bit, because certain clothing is going to be a little bit more UV protective than others. So I won't get into the nitty gritty, because certain things are like an SPF of 8 and some are less. So a long sleeve shirt and covering up is wonderful. And then you can just put some sunscreen on exposed areas. So I do understand that, because you can keep reusing these clothes, but ultimately a lot of the clothing, unless it has protection built into the clothing, actually not providing a ton of protection. So if you can do the sunblock in addition, it's definitely helpful.
Okay, good. That is very good to know.
Yes.
Let me see if there's any more questions I have in particular. Oh, yes. So there's a family. This is a family feud for me and my family. So sun timing. So for me, if you are leaving my front door, you're going to get a slab of sunblock. My family says that's not right. It should only be when the sun is at the highest point of the day, which is 12 o'clock. I don't really go by that. So what is the right answer?
So it is important to stay out of the direct sun during like 10 to 4. Those are the peak hours. But if you can still get burned before that, you can still get burned after that. Those are just the peak hours that you try to avoid being out there. But the main thing is, especially with kids, it doesn't necessarily matter if you're just going on vacation and going to the beach, or you're just going to happen to be out in the sun doing an activity as a family. When your kids are playing sports, when they're at soccer, lacrosse, they're getting sun. It's again, when they're in the shade, I try to slather it on my kids too, on their faces, on their arms, the areas that are exposed when they're playing sports. If they're just playing outside, sometimes a lot of that is forgotten, but.
Good. So my family, if you're listening, that means when I put it on you, when you walk outside, no more complaining because I'm doing it right.
Yeah.
Yes, high five. Thank you very much. So I think we're spraying. So I think we should introduce another poll now. Let's see if there's another poll question that comes up and see what everyone can say in terms of right or wrong. I'm going to lean forward to read it. It says, true or false, sunscreen is not necessary when using cosmetics with SPF. That is such a good question. So I already got one wrong. I'm going to say false. Let's see what everybody says. God, I hope I got this right because I can't get another one wrong. I'm very competitive. All right, I can't deal with this.
All right.
Let's see. Oh, 83% said false. And is it false?
A little bit tough. There's a little wiggle room here.
Okay.
I would say yes, because a lot of the cosmetics nowadays, a lot of the foundations would have SPF. A lot of them are SPF 15 or so. So we typically recommend at least an SPF of 30.
Okay, so it's a trick question.
So if you're going to and from work and you have a good coverage of your foundation, which is also important, and I'll get into a little bit, but you're getting some pretty decent protection. You're not at the beach or anything like that where you're really going to be in direct sunlight for an extended period of time. Okay. But if you're going to be going to the beach, you're going to be outdoors for a prolonged period of time. I want some SPF 30 at least in addition to your cosmetics that may have a 15.
I'm not wearing cosmetics.
And you're not necessarily putting on that much that you're getting really good coverage with your makeup. You've got to have a good amount of it on. So that's a little bit of a sticky question.
The Bello Bellinis, we look like we're ready to play lacrosse when we go to the beach. White all over. I'm not wearing cosmetics at the beach. I don't know who does that. I'm not doing that. So let's get into sun safety. I'm going to bring out the sunscreens. We, of course, had to cover because we are not going to promote branding. And I apologize in advance to all of our viewers who graciously submitted questions about what brands we prefer and which ones are better. So I hope that just the general information that we'll be able to give you will help you along your way to decide which one. And the underlying answer is see your doctor and have her review your skin and see what your risk factors are and kind of determine what would be best, especially if you have a baby, right? Yeah. Babies definitely are a whole nother category of what type of sunblock you should be wearing. So let me get that out. Right. I'm gonna bring my face. Okay, so this plate contains one of my favorites. I'm not going to say which one. Okay. So besides wearing sunglasses, which is a pro, we should be doing. Oh, that's another thing I wanted to talk about. All right. So my glasses have UV already in them. Perfect. And they're polarized. Is that right? Is that good for protecting our skin?
That's good for when you're driving and stuff like that. The polarized lens is sometimes a little bit better with clarity.
Okay.
But the UV protection is really the same.
Perfect. And then my son's as well. I got him with the UV. I think it's 15. Okay. So he looks like a little.
That's great.
Buzz Lightyear running around in his glasses, and he's okay as long as they have that.
Don't forget your eyes.
Perfect. All right. Main events. Let's talk sunscreen. Sure. So I know a lot of questions that we got in probably like 10 minutes prior to this event and throughout the week as our viewers were registering was, is there a difference between chemical and mineral sunscreen? And the mom in me says yes, of course. What is the right answer?
So yes, there's definitely a big difference, and the reason for using one versus the other is going to vary. So chemical sunscreens basically are UV absorbers, and then the physical sunscreens like zinc oxide, titanium dioxide, they are just putting a layer on your skin that deflect and block the UV rays altogether.
Okay.
So one of the biggest reasons one might use one versus the other are irritation, skin irritation. Some of the chemical sunscreens that contain a variety of ingredients, oxybenzone, avobenzone, octisalate, They can sometimes be a little bit more irritating, especially for younger children, for their skin, which
So like this is,
yes,
if you're Bello Bellini, we're going
there
out
you
like
go.
this.
That's got some zinc in there.
This is what we're doing.
Yeah.
And this is why my son hates me in
Right.
the summer.
So sometimes the chemical sunscreens can be a little bit lighter, a little easier to spread. Whereas the physical sunblocks, although they're getting a lot better, they have micronized formulas now.
So this is chemical.
Right. But the physical can sometimes leave a little bit of a whitish film. It might be a little stickier, a little harder to spread, which your kids are like, oh God.
Yeah, I don't care.
But it can be a really good block because it works immediately, doesn't cause any irritation, it's good for acne prone skin.
Oh, that's good.
Yeah,
I
it
know
won't clog your
that.
pores as much because it's sitting on the surface. And again, they've made more micronized formulas, so you don't get that crazy whitish hue. But some of them made for kids, some of them are still pretty thick. But
one of the pictures
get it in
are
there.
looking like this. And
Yeah.
that's that. I
And
don't
it
care
works
what it
right
looks
away.
like.
Some of them have to wait 20 to 30 minutes before they're working. So
Oh my
those
gosh, I
you
didn't
need to
know that.
apply before. Make sure you do it early, whereas the physical,
I did
you can
not
put
know
on and
that.
it works right away.
So for the kids, for example, they're in and out of the pool, in and out of the pool. Don't reapply, leave me alone. They're running away from me. I look like a crazy lady running around the pool. Should I continue looking like the crazy lady?
Yeah.
Okay.
Typically it's every 2 hours, you're out in direct sun, or after swimming, after sweating, you're supposed to reapply no matter what the time is, because both of them are going to start to come off with swimming.
Okay.
And that's when most kids are getting burned.
Okay.
They are because of the lack of reapplication.
Okay, and we're getting some viewer questions as well. So our first viewer question is, how reliable is the magazine Consumer Reports analysis of sunscreens and sunblocks? I didn't even know they did that. Is that a reliable source?
So Consumer Reports in general, I think, is very reliable. I cannot speak to this specifically because I've not seen it.
Okay.
But they do typically do a really good, well-rounded review of products.
And also, I would kind of just feel better coming to my dermatologist.
Sure. We'll give you
Getting
some
a little,
specifics.
exactly, getting a little skin analysis and checking to see, and maybe the dermatologist will have a better answer. Here's another viewer question, everyone. Let's see, what organizations can you Google to get high quality sunscreen?
Check with the Skin Cancer Foundation, and you can check with the American Academy of Dermatology. They'll give you a lot of helpful hints.
That's perfect. And remember, the Rash Guard that we presented a little bit earlier is from the Skin Cancer Foundation. And that was something that brought my eye and attention to it, because that's a reputable organization that you can, of course, rely on. But always, as we learned earlier in the segment, rely on our physician. They're there for us. You know, sometimes I find you call, it's a question that means, you know, I saw you a month ago, we're planning on going to the Jersey store. Can you tell me, based on you seeing me a month ago, what we kind of do for sunblock? Would that be something that's cool?
Absolutely.
Awesome.
And what I tell a lot of people too is the best sunblock is the one you're going to use. So if you hate it and you're not going to get it on there, you're not going to apply it, with kids you can force them. But you can't necessarily force your spouse or something like that. So whatever one you use is better than nothing. So if you like the spray, if you like a lotion, a gel, whatever you use, great. But if you can, at least an SPF 30, broad spectrum UVA, UVB, and water resistant. But no matter what it is, you have to keep reapplying. If it's a higher number, you can't stay out in the sun longer just because it's an SPF of 50 or 70 or 100. Yeah, it's the same as if it's a lower number. You still have to reapply. You cannot stay out longer.
I'm still chasing you.
Yes.
So everyone in my house is still chasing you, and you're wearing this. Another question I have, which before I forget, a viewer had privately submitted to me, and we also had it ready. What about babies, number one? And number two, the grand old question. Now, I have this discussion with my mom all the time. My mom is very old school. I love you, Mom. But is there a difference between 35, 50, 100? I mean, it's ridiculous, some of the numbers you see, and they're expensive. Is there a difference?
It can get very confusing. So there is not a huge difference there. It's not an exponential increase when you go up in numbers. So typically the SPF, sun protection factor, it's measuring UVB rays. We don't have a great measure for UVA at this time, at least in our country. So an SPF of 30, typically it's supposed to, it'll allow you to be in the sun 30 times longer than if you weren't wearing sunscreen and not get burned, not get reddened. So an SPF of 50 plus it blocks about 98% of the UVB rays.
Okay.
But an SPF 30 blocks about 96.7%. They're very close. So you're not jumping up in the protection. Sometimes it gives you a little bit of a false sense of security with those higher numbers. But as long as you're putting on a good amount, which, just to let you know, if you're covering your body for a normal adult, you need about a shot glass size, like 2 full tablespoons of sunblock for your body. So as long as you're putting on an appropriate amount, we'll get that number of protection. If you're using, it's better to use a 30 and apply it properly than just put a thin layer on a 50.
Okay.
You get better protection from putting on the more amount of the 30.
Okay, perfect. So, Mom, I'm not going to buy the 100 anymore.
Yeah.
We're just going to go with 30 or 50 and reapply, and we should be fine. We're getting another viewer question. Let's see what it is. Let's see. What else can you do to protect your eyes besides wearing sunglasses? That's a great question.
So wide brimmed hats are going to help the eyes, the back of the neck, the ears. So a wide brimmed hat is a good idea. Some of us, if you wear contact lenses, they have UV protection as well. So sometimes you get a little bit of protection in that way. But it's mainly going to be, sunglasses or a wide brimmed hat or something to keep those rays entering your eyes.
That is an awesome question. And then for baby skin.
Yes.
So for me, I was a very nervous first-time mom. I was not okay with my son was born in July.
Okay.
All of my
August.
family
I hear you.
okay, exactly.
In August,
and in July, everyone's outside in the pool or come to the beach, kitties, it'll be fine. And I'm like freaking out. Absolutely not. Number one, because I felt like the skin was just it wasn't mature enough to be able to protect itself from the sun. And I didn't want to do any damage to that baby skin by putting either chemicals or mineral on his skin. So what should we be doing? Should babies even be in the sun? Can we put sunblock on them at a young age? Like, how does that work?
So ideally, 6 months and younger, you really don't want them in the sun at all. Try to stay in the shade, keep them well covered. Unless it's absolutely necessary to apply sunscreen, which if you did, it would be a physical sunblock, the zinc oxide or titanium dioxide.
This one.
Yep. You just keep them out of the sun as much as you can.
Okay.
6 months and older, toddlers and everything, then you start getting into the sunblocks, and that's okay. As much sun protective clothing as you can. And then the safest ones are going to be the physical sunblocks because they're not really entering the skin. They cause less irritation. So those are ultimately the best choices.
But so we had no sun interaction, and I love my family to death again, but for all of you, that sounds crazy. I really wasn't. So you said it. Another viewer question: what's the difference between UVA and UVB?
Sure. So we went over a little bit of this, but the main differences are UVB causes sunburn, and again, with prolonged exposure can then lead to skin cancer and other cellular damage, other problems. UVA still causes skin damage that leads to suntan, which is damage to your skin. And then it more often also leads to skin aging, wrinkling, and stuff like that over time. And then the shorter wavelengths can also contribute to skin cancer. So
UVA
both are concerning.
Yes.
That's why we need broad spectrum. Thank you.
You're welcome.
That's why you want a broad spectrum sunblock that can help.
They're both horrible, basically. A is going to give you wrinkles and B is going to give you cancer. So wear your blocks so that you don't get either. I think that's the best option, right? We're getting another question. I love this. Okay. Is retinol condensate an ingredient found in sunscreen and lip balm that is associated with an increased risk of skin cancer? By the way, our viewers are so amazing. These questions are great. I'm so glad you guys are not bored to death with us. This is great.
Yeah. Typically, retinoids, I'm assuming that's what we're talking about now, is retinoids help a little with anti-aging. So they're often used by many of us to try to prevent further damage to skin, wrinkling, sunspots, all that kind of stuff.
Do they make sunblock
They-
with that?
No.
Okay.
We advise using retinoids at night. They can be broken down a little bit by sunlight. But
Is
they
this a
could be,
medication we should keep in the sun?
not necessarily.
Okay.
It is a little bit of a myth that you cannot use retinoids during the summer. Ultimately, retinoids can be sun protective for your skin, but they can make your skin a little irritated and a little sensitive.
Okay.
Therefore, if your skin is overly sensitized, you can become burned more easily.
Okay.
So it's not a true sun sensitivity like some of the other medications. It just, if your skin's more sensitive, you might be tend to burn a little bit more. So you just have to be careful.
Yeah, I was kind of told I was not be in the sun just because there was a possibility that my skin would get irritated. Yes, I'm getting wrinkles and I'm using that now. So yeah, it's a good thing. I think the other question that our viewers sent in was for lip balm.
Yes.
What should we be using to protect our lips?
So lip balm, same exact thing. Some of the forgotten areas, ears, tops of feet, lips. Make sure you use a good sunblock on your lips. Now, there are plenty of chapsticks and different things that come with sunblock now.
Yes.
So
we have our own Northern Westchester hospital.
A lot of them say SPF. Same deal. Keep reapplying. Definitely important not to forget your lips because a lot of people do wind up with some significant damage around the lips.
Yes.
Yeah.
And I've seen that they have some lip sunblocks that are like 50, some are 50. It's the same thing.
It's gonna be the same. It's gonna be the same thing. Yep.
I'm the crazy mom, and I will take this and I put it on his lips. So we're good like that. It doesn't taste good, but he doesn't get burned, so it doesn't matter. We're good to go. I think we're getting another viewer question. Is it okay to wear sandals, or is it a risk to sun exposure? So I'm assuming this is on the beach, or do you want to do both?
I mean, of course, wear your sandals, enjoy. That was kind of one of the things I was just saying. Don't forget to put some sunblock on the top of your feet.
Mm-hmm.
So it's okay. I mean, and I don't want to make it sound like you need to walk out and wear a hazmat suit. I mean, you want to try to protect as much as you can. A little bit of sun here and there is okay. But wear your sandals, just put some sunblock on the top of your feet. Totally fine.
Yeah. Now let's do another poll question before we get to this viewer question that was just sent in for us. This will be our last and final poll question. So once it comes up, we'll see. Hopefully I can get it right. Okay, I'm going to lean in to read. How many times do you reapply sunscreen when enjoying outside activities? Every 20 minutes, every 2 hours, or once every 4 hours? Oh, Lord, I'm the every 2 hour mom, so that's what I'm going with. And I really hope I'm right. If I'm not, I'm still doing it every 2 hours. So let's see what the viewers think. Hopefully, I picked the right answer. So let's see, 92%, thank God, 92% picked every 2 hours, and we're right.
Woo! So every 2 hours when you're doing outdoor activities, or if there's swimming and a lot of sweating involved, you're supposed to reapply more frequently. So if you swim, you're supposed to reapply every time you come out. I know it's a little bit of a pain, but that's what's recommended.
Oh, that doesn't.
Otherwise, if you're just out kind of hanging out outdoors, every 2 hours you should reapply.
Awesome. Let's get to our viewer question. All right, best skin aftercare for sunburns or a day in the sun? That's a good question.
So I don't think there's one best. You want to moisturize and moisturize well with a non-irritating moisturizer. If you want to use something that has some cooling aloe gel and stuff like that can be very soothing for burned skin. Otherwise, just a nice bland moisturizing cream. There are a lot of them out there. It's important to stay really lubed up. Because it can slowly start to really slough over time. So stay well moisturized.
And the peeling and
yes,
whole disaster once that tan starts coming off. It doesn't feel good and it doesn't look good. So I'm gonna check our timing. Oh, we're done. That was way too fast. We had, I think, way too much fun. I learned a lot of stuff. I hope that our viewers and our neighbors were able to take notes. And if you weren't able to take any notes, remember, you can go back to our Facebook page and we'll have all the links that you need there to download the videos, to get some brochures. Always the fallback is see your primary care physician. There's also a survey at the end of this event that we ask everyone to fill out to let us know how well we did, if you want to see us back, or if we should be fired. And before we go, there's one more, waterproof sunscreen. All right, in my family, meaning me, there's no such thing. You're getting reapplied every 2 hours.
Yeah.
Is there such a thing?
No. No sunscreen is truly waterproof. There are a lot of them that are water resistant, and I would look for a water resistant sunscreen. But that was something that kind of years ago was changed on a lot of labeling for sunscreen. So they're water resistant. None of them are truly waterproof.
Okay, that's really good to know. So just remember, any questions, seek out your primary care physician or make an appointment with Dr. Stallings. You can look up her information again on our Facebook page, or you can call our referral line for Northern Westchester Hospital. Remember that this Zoom event was brought to you by Northwell Health and the Cancer Treatment and Wellness Center at Northern Westchester Hospital and the Center for Healthy Living. Dr. Stallings and I are so grateful that you were able to join us. Thank you so much for being part of
Yeah,
this.
very well.
I'm so glad to finally met you. I've heard amazing things.
Okay.
And my family, I hope you're ready to get lubed up, because that's how much you're going to get for the entire summer. I hope you guys enjoyed, and come back and see us when we have our next informative event. Have a great summer, everyone.
Take care.